Ladies and gentlemen, welcome to Global Health. This is your host, Dr. Selim Sılay. After receiving so many messages from Ghana to Nigeria, from Senegal to Tanzania, from South Africa to Madagascar, from Kenya to all the way to all the countries that we see, 49 countries across Africa, we received so many messages to 90552 number through our WhatsApp number. It was amazing. And that's why we had patients which have hypertension, we have patients which have heart failure. They said, we want Professor Dr. Mehmet Akif Büyükbeşe. That's why he is with us. Despite his amazing busy schedule, he did not break our heart. Welcome to Global Health, dear Professor Dr. Mehmet Akif Büyükbeşe. You have become one of the stars of Africa, not just in diabetes, but also, I think, Ramadan, during the Ramadan, as well as the hypertension and now heart failure. Many of our patients want to learn from me, including physicians and some of the health ministers. The floor is yours, Professor Dr. Mehmet Akif Büyükbeşe, and welcome to Global Health.
Always pleasure to be with you. African people are my brothers and sisters.
Thank you.
Hello,
Thank you so much. We received so many messages about your comments on diabetes and Ramadan, the conference. There are some countries who wants to mimic the diabetes and Ramadan conference across Africa, which we will talk maybe later. And there were some ministers of health ministers who wanted to actually consider doing this program and implement some of the initiatives. But in this episode, specifically, we want to talk about hypertension and heart failure. And I want to start for our viewers. What is hypertension and what is heart failure? When does the heart fail?
Okay. Yeah, thank you for this opportunity. Hypertension is very common all around the world. It means high blood pressure. Well, we have a bunch of vessels in our body, namely the veins and the arteries. What I mean by blood pressure, high blood pressure is it's maybe everywhere, but we are considering the arteries and we are measuring from the arm, which is the brachial artery, to understand whether it is in normal limits or not. Today, what we say normal blood pressure is 140/90 millimeters mercury for those people who do not have diabetes. But if they have diabetes, because of the acceleration of the atherosclerosis, which means hardening of the vessels that may lead to lots of complications in our body, wherever the vessels are, then 130/80 is the threshold for saying hypertension for people with diabetes, I may say.
Okay. And in terms of the patients that want to avoid hypertension, and also heart failure, where do they start? What should they do? What are the recommendations to avoid to begin with?
Yeah. If women seem to be luckier than gentlemen, because most of the time, as we look at the high blood pressure throughout the world, after menopause, it seems that the women start being risky for the development of hypertension, but seems to be much earlier in men. However, today, not only in the globe, but also in Africa, we see younger generation to suffer from even not the secondary hypertension, I may call, but rather primary hypertension, which is definitely not much known about. It is called in the past as essential hypertension, but most is this. When we say secondary hypertension, in the past, people were saying that if the people are less than the age of 30, it's the secondary hypertension. That means a little bit treatable. There may be a solution, and definitely lifelong therapy will not be needed.
Sure.
It's curable, what we would like to say, but it's not more than 5% even today. And most of them are kidney disease-related hypertension, whether it is renal vascular or other reasons. But today, unfortunately, primary hypertension may be seen even younger age, so it's very detrimental. What if you have diabetes? if you have, obesity, if you have high cholesterol, if you have smoking addict, then your risk of development of hypertension is increased.
I see.
Both I can say diabetes is a risk factor for the development of hypertension, and hypertension is a risk factor for the development of diabetes. So kind of egg and you know what I mean, hen syndrome. Yeah.
And Martins from Nigeria just sent a message to 9055290700606, and he's saying, Dr. Büyükbeşe, I'm a fan of yours. Your episodes have become really interesting. I have a question about my uncle. My uncle has recently diagnosed with hypertension. He's 42 years old. What are your recommendations for my uncle?
Yeah. Well, yeah. The very first thing is what kind of a personality you are is also very considerable. That should be taken into consideration in order to manage hypertension. So we are not getting, most of the time, we are not getting rid of hypertension today, but we can manage it. What I mean by manage it, we can put it in the normal values. If we start medication, let's say if there's over 140 and 90, but our aim is to drop it down to 130 or 80.
Sure.
If it's in between, still your risk is maintaining. What is the risk? The risk is, hypertrophy, enlargement of your myocardium, your heart, and that will fail later in life if you do not take some measures of getting rid of the high blood pressure readings. So that's number one. But high blood pressure is not only detrimental for the myocardium muscle, but also it's detrimental for other areas, which we like, or end organs like the eye, the retina I'm talking about, or cerebrovascular disease, which may lead to stroke, or it may lead to kidney failure even. We would like to call it hypertensive glomerulosclerosis. So again, proper management is very important. So you have to have a very good communication between the healthcare facility, whoever your doctor is, but you have to have a blood pressure measurement home as well. Number one. Number two, you have to have the right exercise, which we like to call isometric exercise. But starting before the exercise, you have to check your blood pressure is very important, because with a very high blood pressure, we cannot let you do your exercise, daily exercise at that moment before dropping your, because the exercise actually in the chronic phase will diminish your blood pressure spikes, not, urgently. It's not an urgent action. And another thing is a diet. And of course, salt restriction. So you should eat your housewife's dinner rather than going, because they are more salty.
Absolutely. Just received actually a message from from Kenya, Nairobi, and actually this is a physician, a medical doctor. She is graduated from Hacettepe University. She's watching now. She said, I just sent a message to 9055290700606. Dr. Zehra conveys her regards, and she's saying, now in Nairobi, I have many heart failure patients that I'm managing. What are your recommendations to a medical doctor which needs to face all these heart failure patients?
Yeah. Proper treatment of hypertension is very important, because some are hypertensive, but they ignore or deny their hypertension. They do not take their medications usually, or they rarely take it. So there's no regular, or sometimes they skip the follow-up. So these are all complications, invite the complications of high blood pressure. And then heart failure develops soon after the, hypertension. Well, that means the hypertension diagnosis is not that much early. It may be silent, like diabetes, and it may be a silent killer as well. So um, some of them may not have hypertensive anymore because our heart works as a pump, as you know.
Sure.
And if there's a hardening of the vessel, where heart as a pump starts to deliver
Sure.
what it has, the liquid, the blood, I mean, into the circulatory system, it when there's a barrier over there that increases the blood pressure first, but later on, heart becomes larger and larger. But then the heart itself cannot save enough feeding capacity in order to provide the same performance.
That's true.
Now the heart failure starts. It may start after hypertension or after myocardial attack, heart attack, and then the hypertension disappears. This is not healing. This means we are losing the myocardium. Myocardium is not that much effective anymore. But there are gray zones. Not all heart failure patients will have normal blood pressure. Some may still have high blood pressure. Well, in case of not all blood pressure decreasing tools, I mean, the medicines, pills we have today have the same efficacy for lowering the blood pressure.
See.
And we also consider the movement of the myocardium, where we see with the cardiac sonography, which we like to call echocardiography, which is a bit different than the EKG.
Yes.
So as to understand the systolic, which is the squeezing function of the myocardium, and the diastolic, which is the second reading of the myocardium, which we like to call the relaxation phase of the myocardium. So actually, there's a very harmony when the myocardium starts working as a pump, and this harmony becomes chaotic because the ischemia is one of the major reasons after hypertension, which may later in life lead to coronary artery disease, which is ischemia in medical terms. That means you are very much now prone to myocardial infarction. That's heart attack.
I see.
Yeah.
A very, very insightful, analysis. And from Africa standpoint, why is heart failure and hypertension important? Is there a more increase, or is it the same around the globe? What is really the striking points for our viewers? I know Africa, when we say Africa, it's more than 50 countries. It's not fair to say Africa as a whole. Because maybe South Africa has a very different feature than Nigeria versus Somalia and Congo. But at the end, overall, if you do an analysis, maybe Sub-Saharan versus Maghreb or some other, why is heart failure and hypertension important for Africa, Professor Büyükbeşe?
Yeah, well, because hypertension, especially the essential hypertension, primary hypertension, which will be a lifelong one, starts earlier as a comparison to the global average. So that if stays silent enough, then we start putting the diagnosis later in life with the complications, a little bit kidney failure, or already had stroke, or some other reasons, let's say, if not myocardial infarction, heart attack, but coronary artery disease or something like that. So early diagnosis is important. So I mean, every patient starting, whatever the reason is, walks into your office as a family medicine physician setting or whatever it is, you have to check the blood pressure, whatever the reason is. But this is a headache. I guess I had a quarrel with someone. That's why my headache is. It doesn't matter. Just check the blood pressure, what's going. And sometimes I do not stop people talking because if talking, not every people, when they talk or standing up, have skyrocket high blood pressure measurement. That's important. It's about personality, A-type personality or some others. But anyway, that's important. This is a lifestyle.
Yes.
So you let me say, well, my blood pressure is normal, with a normal limit. Sometimes the patients deny hypertension in order to be not one of your follow-up people. But you say, well, okay, but every readings of your blood pressure when you come into my office is sky high.
I see.
You say it is normal at home. You leave home? No. You work in a company. Okay. You bring your blood pressure measurement to your company. What's happening? What is your relationship with your staff over there? Or if you're a boss, or your relationship with your boss?
You start questioning it. Yes.
Yeah, that's very important. So because deny is we are all the reflection of the humankind. We have to respect that. But we may forgive each other, but the vessels do not.
Yes. We have to tackle the realities, face the
Yes.
realities, like you're saying. Absolutely. Well, I want to ask you, overall, I think this was also an amazing episode. What are your final recommendations for our heart failure and hypertension patients, whether they are not diagnosed or when they are diagnosed, for our viewers?
Yeah, well, first of all, I have to say that my grandmother also is suffering from a high blood pressure. Now, the granddaughter is suffering. Let's get the same drug. That's not the issue. Not every pill has the same effect in everybody. Number one, not every pill suits the best for any patient. So it is all about what kind of hypertension you have. You may have hypertension with heart failure. You may have hypertension with obesity. You may have hypertension with diabetes. You may have hypertension with kidney failure. All prescriptions are different, and you have to be followed up, because some prescriptions really the best one for you, but after the development of any complication, it may be different than that. One other thing I can say that, well, you may have leg swelling, for example. You may have angina, what we call in medicine, chest pain, squeezing style or something like that, which reflects to your neck sometimes, jaws, shoulders, and even your left arm or something like that during the, exercise or where you are in stress. This may be a clue for the development of cardiac disease, maybe early sign. So you have to rush into your family medicine office in order to get rid of it. And please have blood pressure measurement machine home as well.
Absolutely. Absolutely.
Yeah, that's important. You have to be your own doctor, but you have to, of course, cooperate with your usual healthcare staff as well.
Absolutely. Well, thank you so much, Professor Büyükbeşe. I want to finally, get your thoughts about the Global Health Program and Afroturk TV and our key messages for our 1 billion viewers across 49 countries across Africa.
Yeah, well, African people are my brothers and sisters. And I have many African friends, even residing here in Turkey. I will invite them to come and visit me as well. And inshallah, I want to visit them one day.
Thank you so much. I think this is an open invitation to Gaziantep, which is a very important city. And you received a personal invitation from Professor Mehmet Akif Büyükbeşe, the consultant diabetologist and the professor of internal medicine in Gaziantep, which is really, working very hard to train the trainers, touch people's life. So I'm sure there will be many colleagues who are visiting them, as well as many patients visiting them in the near future. Thank you so much. I really want to thank you all for staying tuned to Global Health, which has become one of the top healthcare shows across Africa. This is Dr. Selim Salai, founder of Afroturk TV, Afroturk Agro TV, and now soon coming Afroturk Health. Stay tuned with Global Health. Take care and all the best. Bye.